There's a revolution going on today. People are beginning to question their doctors and take a more active interest in their own health. They're becoming informed consumers when it comes to their healthcare choices, and they're looking beyond conventional medicine for answers to their healthcare needs. If you are watching this video, like most, you probably fall into one of two categories. The first is someone who is suffering from a chronic condition such as anxiety, diabetes, fibromyalgia, or chronic fatigue. They've been unsatisfied with their current condition and treatment options and are looking for a solution. The second category is the person who, like the first, is seeking relief from their symptoms that they are feeling, but, like their physician, have no idea as to the cause of them. If that sounds like you, or someone you care about, then your life is about to change. What we're about to show you is a technology that can make a tremendous difference in your health and quality of life. In fact, approximately 90% of our clients report a 90% improvement in just, you guessed it, 90 days. That's right, 90 days. Sounds interesting, doesn't it? It all starts with how you approach the treatment of symptoms. Method A is the traditional treatment method, which typically relies on a conventional baseline history to evaluate a positive from negative test. In theory, a positive objective finding confirms the presence of the associated disease process and dictates the necessary treatment options. The second method includes a group of tests designed to identify patterns of dysfunction that are in the process of developing into diagnosable disease entities. The concept here is that if the pattern of dysfunction can be associated with a known outcome, then the outcome can be prevented. In the case of an individual who has had a long history of subtle symptoms that get worse and eventually express themselves as a diagnosable disease, the first group of tests is certainly helpful in prescribing a conventional course of treatment. However, it does little to assist in addressing the cause of the problem or to suggest viable treatment options. For the individual interested in prevention or who suffers from chronic low-grade unidentified symptoms, the second group of tests is probably more effective and relevant. Our revolutionary technology resides in the second method. Now, this isn't some lost herb or ancient treatment, nor is it a wonder pill or questionable contraption. Our process is called the Matrix Assessment Profile, or MAP for short. It's cutting-edge science based on quantum physics and developed by, are you ready for this? NASA. You see, NASA wanted a way to look at the astronauts' health that went beyond the traditional method. They were concerned about the health of the astronauts 200,000 miles from treatment or on extended stays. They could not afford to wait for symptoms to present themselves. If trouble was brewing inside the astronaut's body, they wanted to find it and address it before it produced noticeable symptoms. I think we all feel like that, don't you? The result of their research is at the heart of the MAP technology, a quantum analyzer that looks at things at a cellular level. With a matrix assessment profile, you can peek behind the curtain of what's really going on inside your body and identify imbalances and deficiencies commonly associated with the development of more chronic conditions before they become diagnosable with conventional testing. It does this by performing a biological fluid analysis. This analysis, combined with a symptom survey and health history review, allow us to see what factors are affecting which systems in your body to contribute to the constant symptoms you're experiencing. Simply put, at Matrix Transformation, we turn symptoms into solutions by looking at things nobody else is looking at in ways that nobody else is looking at them. We eliminate the guesswork and frustration associated with chronic symptoms for which you've been told are normal for your age, require more time and/or testing, or are all in your head. We do this by isolating the cause of your concerns using your personal matrix assessment profile. I know some of you are wondering what's involved in this test. That's a good question, and you will be pleased to know that the entire test comes to you in a little box like this. You will need to fill out a general health questionnaire and provide a urine and saliva sample. That's it. Simply mail it back and receive a detailed report that goes over your results and makes suggestions on treatment options. There is also an option for a personal consultation with the doctor, if you so desire. Imagine knowing why you feel the way you do and what to do about it. With the results of your matrix assessment profile, you'll quickly discover you can create the exact blueprint to be as healthy as you'd like. Gain new clarity and focus about what you need to be doing to maintain your health. Lose weight for good, without deprivation, struggle, or frustration. Banish depression, anxiety, and crippling pain forever. And take the mystery out of anti-aging and longevity. It's a lot to promise, but we know that you will be amazed at how well you can feel. The Matrix Assessment Profile gives you the inside knowledge about your body so you can make informed treatment decisions. It's almost like cheating. See what's causing your symptoms today with the Matrix Assessment Profile from Matrix Transformation. Matrix Transformation, turning symptoms into solutions, one molecule at a time.